Good morning. I am Jeanette Gibbs, Senior Vice President for Ambulatory Services for Penn State Health. Back in January, I was given the honor to lead a team to establish and operate community vaccination sites and pop-up clinics across our region. I'd like to welcome everyone to Penn State Health Dauphin County Community Vaccination Site. We just had the privilege of giving Governor Tom Wolf, Acting Secretary Allison Beam, and Acting Physician General Dr. Denise Johnson and their team a tour of our clinic. We're deeply grateful to Governor Wolf and his leadership within the State Department of Health. They have been steady, supportive partners of us in caring for COVID patients, preventing the spread of this virus, and now in vaccinating our communities. We opened this Penn State Health Community Vaccination Site, as well as companion clinics in Reading, Camp Hill, and State College back in February. Since that time, we have vaccinated more than 75,000 people at these community sites. We're also a partner in a large multi-health system clinic in Lancaster, similar to this one, the one that Governor Wolf visited a few weeks ago. That clinic has also vaccinated another 80,000 people. That's on top of nearly 2,000 community health providers and nearly 20,000 Penn State Health and Penn State College of Medicine employees, volunteers, and students. All told, we have vaccinated nearly 80% of our people. I'm particularly proud of our efforts to reach underserved and vulnerable populations. Even before COVID hit our nation and our world, we knew that certain populations struggled with access to health care. We know some communities are more susceptible to poorer health outcomes because of health disparities and socioeconomic conditions. Research has shown that this zip code plays a critical role in our life expectancy. To reach underserved and vulnerable populations who might not otherwise have access to the vaccine, Penn State Health has partnered with community organizations including the NAACP, the Area Agencies on Aging, Lebanon Family Health Services, and Latino Connection Incorporated to take this vaccine into churches and community centers and health clinics. I was just with Acting Secretary Beam on Monday at the Beacon Clinic in Harrisburg to kick off the CATE COVID-19 Mobile Vaccination Unit. We are grateful for the support of our partners in this endeavor. We've had actually about 15 of what we are calling pop-up clinics in places like inner city Lebanon, Lancaster, Reading, and Harrisburg, as well as rural communities like New Bloomfield and Perry County. We have many more planned in the coming weeks, and through these clinics, we have nearly reached 2,500 people. We appreciate the many employees and volunteers who have organized, promoted, and staffed all of our vaccine clinics. Ultimately, we are all working together for one goal: to ensure anyone who wants to be vaccinated against COVID-19 can be. At this time, I am delighted to introduce Pennsylvania Governor Tom Wolf.
Thank you, Jeanette. And I just we have Secretary of Health Beam here, and also our Physician General Denise Johnson and Dr. Bill Curry. You'll hear from a number of them in just a minute, but thank you for being here. You know, we're trying to social distance here. Do you want to, you're far enough apart, make sure you're, okay, all right. But thanks again, Jeanette, for that introduction. And she's right, I just toured the facility here, and it makes me really proud, but I think all of us in Pennsylvania owe a great debt of gratitude to the folks who do this. I love visiting these vaccination sites. What goes on here is really, really important. And I love talking to the frontline heroes who actually make this kind of a site work. And also the individuals who are getting the shots, they're heroes too, because they're helping to make all of us safe. They're making themselves safe, obviously, by getting the vaccine, but they're helping to make everybody in Pennsylvania safe. The more people who get vaccinated, the safer all of us are going to be, and the sooner we can get out of this. COVID-19 has been a problem for all of us over the past year, 13 months. But now we have a way to fight back, and these vaccines are the way we can fight back and actually move on to the life that we'd like it to be. I've often talked about, and not just me, but all of us talk about how vaccines are the light at the end of the tunnel. Well, that light is here, and that light is getting closer and closer every day. I mean, the mitigation efforts are important. They made a difference during the pandemic, but right now, this is the key to our future, these vaccines. And getting back to life as normal as it can possibly be, these vaccines are the key. With every dose of vaccine we put into arms, the entire Commonwealth gets a little bit closer to that new normal, and that's really important. We still have a lot to do. We still have a ways to go, but Pennsylvania is really making great progress in the vaccine rollout. As you know, Pennsylvania ranks in the top 15 in today's New York Times report. We were actually 10th on the first dose list, the percentage of first doses. We're actually first on first doses, the percentage of the population with first doses. First of the 10 largest states in the country. We're second to New York only on the second doses. And the Becker ranking has us at 22nd as of yesterday. They come out about 10 o'clock, I think, every day. So I don't have their ranking. I should have it. If you look at Becker, you can get it. I don't have it at this point, but we were 22nd yesterday. But if you look at it, over 40% of the Pennsylvania population has gotten at least one dose of the vaccine. That's 1 in every 5 Pennsylvanians. Actually, it's more than that. 40%, it's almost 1 in every 2.5 of the population. 1 in every 5 has gotten the second dose. I think we're 23 or 24%. So this is great progress, but we can't afford to take our foot off the gas pedal, and that's why, as supply has increased and appointments become more available, I mean, there are openings here. If you walk in today, you can get a vaccine. We really need to keep moving, but that's basically why Pennsylvania has moved up. You know, initially we were talking about maybe everybody would be eligible by the end of April. Then it was by April 19th, and last week we moved it up to this Monday, past Monday. So this is really important. So I know some of us, including me, have been waiting. We didn't want to butt in line to make an appointment. But right now, what we need is for as many Pennsylvanians as possible to get the vaccine. I'm actually getting my first dose on Monday. So that's my job. So don't wait. Talk to a vaccine provider and book your appointment today. These vaccines are both safe, they're effective, and the stories of millions of people in Pennsylvania who have gotten the vaccine alone that attest to that. Now, I know the recent Johnson & Johnson pause has actually created some questions, but I think what it really does is should give us reason to be more confident that these vaccines are safe. There have been almost 7 million vaccines, Johnson & Johnson, that have been given out in this country, and there are 6 cases. 6 out of almost 7 million, 6.8 million, of a rare disease that I'm not sure anybody, I'm not a medical professional, but I'm not sure we even know that it's connected to the, how much it's connected to the vaccination. The scientists are working on that, and they're watching these vaccines and watching the vaccine rollouts very carefully, and I think that should give us all the kind of confidence that we need. More information about vaccine safety is going to be coming every day. More trials, the extensive trials that all of these vaccines went through and continue to go through. I think, you know, what we're doing right now and what's happening with the vaccine should give us all comfort. If you want more information, you can go to the website, the Pennsylvania Department of Health website, which is health.pa.gov. Or the Centers for Disease Control. They also have a good website if you want to find out more about what's going on at any point in time. But as the rollout continues, we want to ensure that all Pennsylvanians have access to the vaccine, because the more people get vaccinated, again, that's going to make us all safer. So thank you, and now I'm going to turn this over to Secretary of Health, Pennsylvania Secretary of Health, Allison Beam.
Good morning. I am thrilled to be here at Penn State Health this morning. It's always an honor to be at these vaccine clinics where folks really are having the COVID-19 vaccines get into the arms of Pennsylvanians. So April is a critical month in where we are with the pandemic and the rollout. The governor had indicated, as of Tuesday, every Pennsylvanian 16 and older is now eligible to go schedule that appointment to get vaccinated. We have a steady supply of vaccine coming into the Commonwealth for those who want it. And so we really do want to encourage folks to get vaccinated, get that appointment scheduled, and get vaccinated as quickly as possible. The Department of Health just yesterday issued data on our website that evidenced that even within our skilled nursing facilities staff, the folks that have been our frontline heroes throughout this pandemic, there was an uptake on average of 53% of that workforce actually getting vaccinated when it became accessible to them. While that's better than the national median of 37% of skilled nursing facility staff, that evidences how far we have to go and how much of a challenge overcoming this vaccine hesitancy will be in the near future. And so we need your help, and we look forward to working with you to have Pennsylvanians overcome that hesitancy and any of that skepticism and get that appointment scheduled. And so with that, I just want to thank you all for the opportunity to be here today. Thank you to Penn State Health for all of the heroes inside that are getting vaccinated. And it's my privilege to now introduce Dr. Curry to speak a bit more from Penn State. Thank you.
Good morning, and thank you for joining us. I'm Dr. William Curry. I'm a physician in our Department of Family Community Medicine here at Penn State Hershey. I want to talk this morning about how important it is to get vaccinated and about vaccine safety and effectiveness. We know the Johnson & Johnson vaccine has been in the headlines these past several days. What people are reading and hearing may cause them some hesitation to get a vaccine, and I want to ensure you that vaccines are safe. We know that there are reported blood clot issues caused by an immune mechanism in 6 women out of almost 7 million people that have received the Johnson & Johnson vaccine. This is an extremely low number. At this time, we do not know for certain that those blood clots were caused by the vaccine, but the FDA and the CDC recommending a pause in distribution, it's a reassurance that the safety of Americans is being considered very seriously. The Pfizer and Moderna vaccinations, they are a different type of vaccine. They are made from a different technology, and they have been shown to be safe and effective after nearly 190 million doses given. There have been no cases of immune-based blood clotting complications that have been seen in these 6 women with the Johnson & Johnson vaccine. The risk of getting ill with COVID is greater than the risk of potential side effects that come with the inoculation. Many more people will suffer the complications of blood clots associated with having a COVID infection than we will see with vaccine administration. Getting vaccinated is critically important. It is the best way to protect ourselves, protect our loved ones from getting ill or dying from COVID. Vaccination is the best way to halt this pandemic. We hear a lot about how people die from COVID. The numbers are far too high. But one thing that we need to remember is that while there are a lot of people who have survived COVID, there's a large number of these people who continue to live with life-altering issues. Many people who have survived COVID continue to live with heart issues, neurologic issues, breathing issues. Many people become what we call the long haulers, people who continue to suffer with COVID complications for weeks and months. A person not getting vaccinated puts not only themselves at risk, but their loved ones to the possibility of getting COVID and suffering long-term effects or even death. I urge everyone, my family, my friends, the patients I serve and those in our communities to get vaccinated as soon as they are able. Penn State Health is happy to help you get vaccinated. You can register today to sign up for an appointment at this clinic or one of our other clinics throughout central Pennsylvania. With that, I welcome Governor Wolf back to the podium.
Thanks, Dr. Curry. Okay, any questions? Yes.
I was at a vaccine clinic yesterday in Lebanon County, and they said there are hundreds of appointments going unfilled. What is your worry about wasted vaccine with people not showing up or not signing up in the state? And number two is a follow-up. Do you know what vaccine you're getting?
I don't know what vaccine I'm getting, so thank you for asking. But Allison, why don't I ask you to as far as we know, and we track this, the wasted vaccine issue is there isn't much going on. What is an issue, and it's here, is that there are, as you point out, open appointments right now. Now, think back a week ago. You know, everybody said we can't get enough vaccine. Now we have too much vaccine apparently. So it was one of the things that led to our decision to move the eligibility forward. But I don't think waste is the issue. It's making sure, and I said, as Secretary Beam talked about, the hesitancy issue. You want to weigh in on this?
Sure. So the crux of the question is really those appointments give us pause because of hesitancy. I think to the waste issue, we've talked a lot to our provider community, and they actually have logistics operations set up that they are really thawing out proportionate to what their appointments are. And so we're not seeing an uptick in waste. The appointment availability does give us cause for concern, though, because that's indicative of the hesitancy, which really is the challenge to come.
Speaking to the issue of waste, one of the things that we do and many other vaccination clinics do is they have a list of individuals who have not been able to get on the schedule list, but they have made it known that they will be here if they make a phone call to them. And so we will never close a session without going through that list of individuals who want the vaccine but haven't been on the schedule, and we do that quite well. There was one day a few weeks ago where there were several extra doses that were drawn up, and we made calls. 24 people got in here. We delayed the closing of the clinic until they could get here and get their immunization. So we don't waste it. We have people that are willing to come. So I think that's really important.
Charlotte.
Yes, I was curious. I realize that it's only been a couple days since the vaccine has been available to the general populace, but in your study of the dynamics, are you seeing any signs that lead you to believe that there really is a large group of the population that is hesitant? I mean, you know, I think right now there's probably way more appointments available than there ever have been because of the scaling up. But even with the news of the Johnson & Johnson, have you seen anything that actually gives you any data points that point to an uptick in this, or at least some real empirical proof that there is hesitancy?
I think it's too early to say that statistically the Johnson & Johnson pause is causing any increase in hesitancy. But hesitancy was an issue that we've been looking at right from day one. It was covered by the fact that the supply wasn't up to demand. So the theme for the first 3 months of the vaccine rollout was there's just not enough supply. And so the hesitancy issue didn't really rear its ugly head, I think, except maybe in some of we had some concerns in like nursing homes, the professionals, like as Secretary Beam said, 57%. But we know that is going to be an issue, and the vaccine task force has been, we have been talking about that you know, we weren't sure when it was going to happen. I think in some places it's happened maybe sooner, but you're starting to hear advertisements in places like New Jersey where it's saying, okay, go out and get your vaccine. Well, 3 weeks ago there were no ads saying go out and get your vaccine, because everybody who wanted a vaccine, you know, they were lining up. So hesitancy is something that we have known for a long time is going to be there. I don't think we have any good statistical information about whether the specific Johnson & Johnson, it actually might reduce. As I say, in my mind, I'm more confident than ever that the FDA is actually on this. So it might actually reduce hesitancy. But the idea that there is an issue of hesitancy has been with us right from the beginning. Allison, do you want to add anything to that?
You covered it.
Okay. Charlie.
Also, on the Johnson & Johnson thing, I think the latest news on that is that it's probably going to be paused at least for another week or so. I think the next meeting on that is the 23rd. And I was just wondering, does that cause any complications for Pennsylvania? I've been reading about some other states where they have geared the Johnson & Johnson for the most vulnerable populations, like the homeless, college students, that people where they might have trouble tracking to find to get an appointment certain for a second shot, that some states are worried about that. I know in Pennsylvania the emphasis with the Johnson & Johnson, the one big public emphasis was the teachers, and
we're finished with that.
Yeah, and I was just wondering, are there other marginalized or underserved populations that you're worried about hitting if you have to keep Johnson & Johnson on the shelf for a while?
I don't think so. As you pointed out, the teachers, and then we also did frontline essential workers like food processing, agricultural workers, but all that happened before the pause. The other thing is that aside from the last week in March, the allocation, and the first week in March, I guess, the allocation of Johnson & Johnson has been, Moderna and Pfizer has been fairly steady. I mean, steadily increasing. Johnson & Johnson has fluctuated a lot, and the last couple of weeks there wasn't that much coming to Pennsylvania anyway, directly to the state. There was some coming through the pharmacy partnership, but we didn't control that. So it hasn't been a big factor, I don't think. Allison?
So the Johnson & Johnson vaccine, following the teacher and the child care workers, we're dedicated to a mission to work on making sure some of our frontline employees got vaccinated as quickly as possible. That not only was in the food and agricultural industry, like the governor had mentioned, but also making sure that we were able to work through our corrections officers and our corrections facilities. What we've done is prudently paused that until that Friday meeting is taking place, but we're already building contingency plans. So if there is an extended pause on Johnson & Johnson, how we're going to be able to still fulfill that obligation and that commitment to those populations, but using the Pfizer and the Moderna vaccines. And so where we have put any sort of allocation towards those specific missions, we will fulfill our commitment. It might require us to shift a little bit in our planning, but we're going to be able to pause right now, really follow the federal guidance, and wait and see what Friday says, and then we'll adjust accordingly.
Secretary, if I can follow up on that, are there any groups, be it prison inmates or corrections officers, or any groups that have actually seen a dedicated vaccination program that have been put on pause?
Correct. The corrections officers and actually those that are the incarcerated individuals in corrections facilities is on pause right now. Likewise, through our Department of Human Services, we had specific initiatives to reach some of their facilities as well. And then also some of our food and agricultural worker populations are on pause. And so we're doing the prudent thing by following the federal guidance and really aligning with what a SIP's committee meeting schedule is going to allow for us. And so once we learn more next Friday, we'll pivot accordingly, but we're already working on our contingency plans to make sure we're ready to do that.
Okay, yes.
In regards to addressing hesitation, looking at young people, I know that we open eligibility to 16 and over right now. With that demographic, do we right now have data on how many people have taken advantage of the shot? And then the second part of that question, is there going to be a specific address to get young people who may be more reluctant to get the shot because they are quote unquote healthy? Okay, go ahead.
The answer to the first question, we don't at this point know what's happening with the younger population. They were eligible as of 3 days ago, so it's too early to tell. But we have been talking for at least a week now in the vaccine task forces to help, maybe even longer than that, how we reach this group, because that's where the uptick in COVID cases is happening. And so I think there's some really good ideas, and I think we'll have a program in the next few days as to how we want to do this. Again, it's complicated a little bit. It would have been easier with the one-dose vaccine. But I think we can do some things. We've been talking with the folks in Washington to see if maybe we can partner with the federal pharmacy partners to help with this regard in terms of the second dose. So we haven't finally come to one program that or policy that we want to pursue with the younger generation, but I think it's coming, and I think we have some good ideas. I think yes.
Governor, thanks again for the time. Can you tell us any more about your vaccination on Monday? Will you do it privately, or are you thinking about having it public to set an example for folks? And two, are you thinking of launching a campaign to get people vaccinated, like mass campaigns that we've seen?
Well, I mean, we're in the middle of a campaign to get people. I encourage anyone to get a vaccine. I waited because I didn't want to butt in line, and I'm going to be doing it in York at a federally qualified health center. And I don't even know what the time is that I have the appointment, but I think they probably have rules about privacy inside the building, but I don't care. So I'm doing it on Monday.
And just a quick follow-up. Are you thinking at all about having maybe more vaccine clinics that you don't have to have an appointment? I think there's one in Pittsburgh where people can just go up now to get it, that might help.
I think actually more of these than you know have been operating like that. I know even our local drugstore pharmacy has been, if they have vaccines left over, just like Dr. Curry said here, if they have vaccines left over, they make every effort to call people. So it's not just walk in, but they actually go out and say, come on in and get your shot. But I think today here, if somebody walks in, right now they do have open slots. And I'm sure we'll see more and more of that. Yes.
In terms of, you're talking about a public campaign like you're doing right now. Have you thought about who the message needs to come from? Obviously,
Yes.
there are some people who, if you say you're going to get it, they're still not going to listen to you. What ways are you reaching out to the community to get the message out there?
We were actually just talking about that. I mean, I think that is the crux of the question. What is the best way to reach out? I mean, you think about all kinds of famous people but actually it turns out probably the best people are your next door neighbor or your mother. But Dr. Johnson.
Yes, that's a very good point. We found out from listening to our stakeholders and listening to the public that the messenger is as important as the message. And so for our PA Unites Against COVID campaign, we're looking at who to take the message to the different groups. We've also found out that some people want to hear the message from someone who looks like them. Someone wants to hear the message from someone who speaks their language. So our outreach is going to be very broad and cover all of those areas. And so we're utilizing all of our partners to take the message out for vaccination. Thanks.
Apparently not everybody wants to hear it from a bald-headed governor of Pennsylvania. Charlie, you've already had 3 questions. Are you sure you're this will be it?
Well, I just wanted to ask you, you mentioned a public advertising campaign, a public media campaign in New Jersey. Maybe there's something like that going on in Pennsylvania that I've missed, but if not, are you thinking about doing that with the message of the vaccination?
Yes.
So we'd see television commercials?
We are. I mean, maybe Dr. Johnson can talk.
Oh, yes. Oh, that was last night? Yeah. Yes, so we are again partnering with everyone to take the message out. I understand last night at the Penn's game, the stadium was all decked out in PA Unites Against COVID. So we do have a media campaign that's coming out. It's going to be coming out in print and digital. It's going to be on social media, and it's going to be starting in this month. So we are trying to get the message out. We also have a lot of resources available on our website. So we've got social media filters, we've got stickers that people can share. So a lot of information coming out in the media on this campaign.
Yeah. This will be the last question.
In regards to delivering the message, I think that's an important topic. Is there any effort being done to those who may have disabilities, either the hearing impaired or the blind? Are there going to be communication efforts there?
Yeah, that's a great point. We have, and I've said this a number of times, we recognize that there are at least 3 different channels. One's sort of like this, where you can drive in and get the vaccine, or the pharmacies, providers where you're basically responsible. We're also setting up mass vaccination places in stadia so that people can get the vaccine. But then it leaves people who are shut in, people who are disabled, people who can't get out, and that's where our mobile sites come in. We need to do more and more things like that, and I think we're looking to see what is working all around the country in that regard. But we know that's an issue. I think we've had some success, but we still have a lot of work to do. Anybody want to add in? Okay. All right. Well, thank you, everybody, and get your vaccines. Thanks very much.
I think Jeanette shared with you that we usually see about 800